That's my visual aid. Okay, and here are the audience. And we'll start. Okay, so we'll go to the next one. So the start of this is 1 in 5 people have sleep apnea. So with a room of 5 of us in here, at least one of us would have sleep apnea. I think it's important to know what sleep apnea is and ways to either help prevent symptoms if you already have them, or ways to reduce your chances of getting symptoms if it runs in your family, or if you just have anatomy abnormalities that could cause you to have sleep apneas. Some of them would start off by having these symptoms of snoring, excessive daytime sleepiness, witness apneas. I would call myself knowledgeable on this subject because I have been doing sleep study authorizations for over a year, and I work closely with physicians and pulmonologists mostly. Those are the doctors, sleep doctors, and I go back and forth from insurances to the doctor's offices, trying to plead basically the patient's case of why they need a sleep study approved so they can start treatment with either CPAP or BiPAP. And pretty much I just try to get that approval for the patients. And you can click. Like I said, these are just some of the symptoms. To start off with the snoring, the excessive daytime sleepiness, witness apneas that other people can witness, choking in your sleep, just some of them. And I would say typically is developed from your genetics. It can be hereditary, so if your mom or dad have it, or cousins, anything like that, it can be passed down that sort of way. But it can also be due to, like I said, anatomy abnormalities, as in having a smaller throat or smaller airway, or having a larger throat or larger airway. If you suspect that you do have it, you can avoid it by doing certain things to stop the symptoms, or people who already have it, they can reduce their symptoms by getting a CPAP or BiPAP. And though there are many different causes, in addition to obesity, with most of them being hereditary, it can include a narrow throat area, like I said, or having a round head. Typically, these abnormalities are can be worsened by having other medical conditions like high blood pressure, a bunch of other different medical issues can result in sleep apnea as well, but you can try to reduce that by also making sure that you are at a healthy BMI or a healthy weight. Also by making sure that you're making lifestyle changes that are healthy for you. So that will be exercising daily, making sure you're not smoking, making sure you're eating healthy. And all those are normal ways to prevent obstructive sleep apnea if you don't already have it. You can click there. And this is just a picture of how a normal airway looks for someone who doesn't have obstructive sleep apnea versus someone who does have obstructive sleep apnea. And these again are just ways to help yourself reduce developing sleep apnea symptoms. Like I said, just by stop smoking, if you already smoke, staying active and losing weight would all help you. And For those who already know that it runs in their family or they have no way to get rid of it, only way is to reduce it if you've already been diagnosed with it. Um, obstructive sleep apnea is a chronic condition, and all there is though immediate cure, there are alternative ways to alleviate your symptoms or to help yourself sleep better at night. And one method these are some of the methods to reducing the severity of your sleep apnea. You can wear the CPAP or the BiPAP machine. That's one way of helping, and that just gives you continuous airflow while you're asleep instead of having those witness apneas where you're pausing in the middle of your sleep, which can be, fatal if your heart goes that long enough without that oxygen. So just some ways is the CPAP and BiPAP. Most people don't, or they can't take they call it the pressure of the CPAP and the BiPAP, so they choose for like oral or dental appliances. And also positional sleep therapy, which positions you to learn how to sleep in one way, because sleeping on your back, of course, worsens your obstructive sleep apnea. So these devices, I think, just help you get in a better position and teach you how to stay in that position all throughout the night. And these are just some more images of how the CPAP and the BiPAP work. The CPAP is like for a mild person with mild obstructive or moderate obstructive sleep apnea, versus a BiPAP is someone who has, between 30 or 50 central sleep apneas a night, and they need that. I think it's like something airflow. Skip. So, in conclusion, I just wanted to say obstructive sleep apnea and other sleep apneas are on the rise, but they aren't talked about as much as I would say diabetes. Those are big medical, conditions that most people have, but they don't take care of. Obstructive sleep apnea is definitely one, but surprisingly, there are 18 million people in the world that have obstructive sleep apnea, and only like 20% have actually gone and gotten treated or even, have thought that they had symptoms. So that's actually a really low number, 20%. So it just shows that, you need to be more aware and more cautious if you think or it runs in your family. But that was all for my speech, and I thank you guys for listening.